Good evening, and thanks for watching WRTV News at 6. I'm Mark Mullins.
And I'm Amanda Starantino. Tonight we begin with a story doctors want you to know about. New treatment, they say, that helps high-risk patients fight COVID-19. Eli Lilly created a drug used for antibody infusion therapy and is partnering with local health systems to create infusion centers across the state. WRTV's Stephanie Wade explains how this new treatment works in the effort to expand to help treat more Hoosiers.
It was just amazing what it did for me. I mean, it was just like a miracle. It was just shocking.
At first, Chris Roark Jones says she was hesitant to try antibody infusion therapy after being diagnosed with COVID-19.
I just always think, gosh, I hate to be a guinea pig.
But after receiving the relatively new treatment 2 weeks ago, she says her symptoms improved almost immediately.
Every single thing that was wrong with me, my sinuses cleared up. It was just amazing. I call it like a miracle, and it's just too bad more people don't know about it.
So you really feel that it helped you?
Oh, absolutely. My oxygen level within 24 to 48 hours after the IV went from 92 to 93 to 97 and 99.
It reduces hospitalization by 70% in this patient population.
How it works is patients undergo an hour-long infusion of Eli Lilly's drug, bamlanivimab. Different from the vaccine, where your body has to learn how to fight off the virus by building its own antibodies, this infusion therapy immediately gives patients the antibodies. And where convalescent plasma uses actual antibodies from a recently recovered patient, this drug is artificially scaled to use the most potent antibody known to neutralize the virus, allowing your immune system to recover quicker.
Ideal individuals for COVID-19 therapeutics, whether it's Lilly's or others, are individuals who are recently diagnosed. They're within 10 days of symptom onset, and they're at high risk for either hospitalization or death.
Janelle Sabo with Eli Lilly estimates more than 2,000 Hoosiers have had these therapeutics to date after only being created about 3 months ago. It's best for patients not yet sick enough to be hospitalized with mild to moderate symptoms. Hospitals like IU Health have created their own space to isolate patients and streamline treatment for those who could benefit the most.
Anyone who gets tested through IU Health and has a positive result, we review their charts, see if they are potentially eligible for treatment. If they are, then we will reach out to them to see if they're interested.
I tell all my friends, I tell anybody that'll listen to me. I said, if you know anybody, let them know.
Recovered patients like Chris now want to get the word out about infusion therapy treatment, saying you don't have to suffer.
If you're in any risk at all, I would not walk but run to get that IV.
Stephanie Wade, WRTV.
Eli Lilly has also partnered with Community Health Network, Eskenazi Health, and Franciscan Health to set up an infusion center and increase access across the state. They want to help other locations open their own dedicated infusion centers. To learn more about this treatment, visit our website at WRTV.com.
It's a chance to save lives and make people healthy and encourage people through a very difficult time.
On Tuesday, the Biden administration announced it's expanding the pool of partners to distribute the COVID-19 vaccine to numerous chain pharmacies across the country. But this comes after Governor Eric Holcomb and state leaders announced it was partnering with Meijer, Kroger, and Walmart to continue the rollout here. WRTV's Nikki Dementri is breaking down what all of this means for Hoosiers tonight.
Many of you have heard about the National Pharmacy Vaccination Program that will bring an estimated 20,000 additional doses to our state each week.
A federal program Kroger, Walmart, and CVS are all a part of, but not all three will immediately be options for Hoosiers.
We all know what a difficult period this has been, and this gives us something, a cause of optimism as we look toward a normal life.
Here in Indiana, Kroger seems to be the first federal partner helping get shots in Hoosiers' arms.
This enables us to expand the reach of our vaccination program in Indiana.
Last week, Kroger began vaccinating eligible Hoosiers in 45 stores across 16 counties. Stores picked by and vaccine provided by the state. With the federal partnership now, Kroger spokesperson Eric Halverson says the earliest the program will expand to all of its Indiana pharmacy stores is next Thursday.
How many vaccines are we going to be seeing
that you will be getting in these stores.
That'll be something that'll be determined as we work with the federal partners on this. But the simplest way to describe it is to say we will have 100 doses per store per week.
A Walmart spokesperson told us a full list of stores participating in the federal rollout will be available in the coming weeks. As for CVS, 2 Indiana pharmacies are already providing vaccines, but not under the federal plan. A spokesperson tells me it's partnered with the state to provide, quote, a limited predetermined number of high-risk individuals aged 80 and older the COVID-19 vaccine at 2 unnamed CVS pharmacies. What's next for CVS COVID vaccines in Indiana will be determined later on.
We continue to work to expand appointments and vaccine sites.
Last week, the state partnered with Meijer, Kroger, and Walmart, and vaccine distribution has started at select stores, including now federal partners Walmart and Kroger. All require an appointment. The main difference between the state's partnerships and federal partnerships is simply where the vaccine is coming from.
As soon as more doses are available, we will elevate the number of doses in each store and reach as many more people as possible.
Working for you, Nikki Dementri, WRTV.
As a reminder, the vaccine rollout is only for Hoosiers aged 65 and older at this time. For those